you all for your time, certainly that are taking time to watch the recorded version as well. My name is Greg Stancil. I work with Scott Benefit Services, and we're the consulting firm that works with Market America on all aspects of the employee benefits, the group health plan, the disability, the life insurance, all those type of things. One of the things that we get a lot of questions about when people start getting towards that 65 mark is Medicare. Now the good news for you is I don't sell Medicare, so I'm not going to try to sell you anything, which is nice. I'm not going to try to put any pressure on you. I'm just here to educate you guys and help you learn a little bit more about Medicare, how Medicare works and what your options will be as you sort of get into that 65 range, okay? So I will have, for those locally here, I've got a contact on the very last slide that is local here in Greensboro, that if you're interested in pursuing Medicare, a Medicare supplement or a Part B plan that we'll talk about, I've got a guy that you can call that will do that for you. For those that are watching the video remotely and aren't in North Carolina, you can contact Ed Kester. He can get you access to somebody in your city or state. So let's just dive right in. Feel free to make this informal. Ask me any questions that you have as we go along. Again, this is 30 minutes is your time. We just want you to walk out here knowing a little bit more about Medicare than you did when you walked in. So first part, just an overview. Obviously, Medicare is a federal health insurance program. It's for people typically that are just over 65, and it also applies to people with certain disabilities. I've got a really good friend that had to have a double lung transplant at age 30. He's on Medicare because he's got a disability. But typically it only applies to people that are over 65. The original Medicare, and we're going to talk about a lot of different things here, but the original Medicare contains two parts, okay? So when we're talking about actual Medicare with the government, we talk about it in parts, okay? When we talk about supplements and things like that, we're going to talk about plans. So whenever you hear part, like Part A, Part B, Part C, Part D, we're talking about the government, the actual different parts of Medicare. If you hear about a Plan A or Plan B or Plan F, that's typically talking about a supplemental plan to help supplement your Medicare, okay? So Part A helps pay for hospital visits, and Part A is normally free. You typically will automatically kind of get enrolled in that Part A and get a card in the mail when you turn 65, okay? Part B helps cover your doctor's visits and your outpatient care, and that has a monthly cost associated with it that we'll talk about in just a few minutes.
Actually, you have to go into Social Security.
Yeah, and actually apply for it and tell them you'll get your card automatically, but you actually have to go into the website or go up to the Social Security office and acknowledge. But their sort of assumption is that you're going to automatically take that Part A. Now, Colbert, these folks are kind of frantically writing stuff down. Can we get the slides to them? Okay. So take what notes you want. It makes me feel really good if you're writing stuff down. It makes me feel like I'm saying something intelligent. But I want you to just feel free to absorb it and ask questions, and we'll email this stuff to you, or get it to Colbert, and you can get to them in whatever way is appropriate. And we'll make the slides available as well to the folks on the portal that are watching. So we'll talk about the cost of Part B in just a minute. Now, Medicare Part C is a Medicare Advantage plan. Okay, that sort of takes your Part A and Part B and what would be sort of a supplemental plan and sort of bundles it all together with Part D as well. Okay, so that's a kind of a completely separate discussion that we'll have around Medicare Advantage. Medicare Part D is the prescription drug plan. So Part A and Part B don't cover your prescription drugs. Okay, if you want to have prescription drug coverage, you have to buy a separate policy under Medicare Part D that's administered by an insurance company. Okay, so this is administered by the federal government. This is administered by the federal government. This is actually administered by an insurance company, Medicare Part C, and Medicare Part D is actually administered by an insurance company. Okay, so government, insurance. Okay, any questions just about the structure and the parts? We'll talk about the costs and all those things in just a second. So how do you get into Medicare? There's an initial enrollment period. There's three different ways. You got your initial enrollment period, and I've got here 3B3. Okay, so that's 3 months prior to your birthday month, and then 3 months after is your sort of initial opportunity to enroll in Medicare. Okay. Then you've got a special enrollment period if you lose your employer coverage in Medicare eligible. So if you turn 65 while you're working here at Market America, nobody's going to make you drop your Market America plan and go to take Medicare. You can if you want to, and some people choose to do that. That is a qualifying event to drop your group coverage if you choose to do so. But you're not required to. Yes, ma'am.
If you do take the Medicare at age 65 and you're still working here, and then you have, like if you go in the hospital, if you go to the doctor, which insurance is your primary insurance that covers the biggest part of that?
Well, I would recommend you not take, I mean, you can take the Part A because it doesn't cost you anything. I would recommend that you not take the Part B and pay for it if you're going to take the group plan. I would recommend you do one or the other. If you, however, chose to pay for both, as long as you're an active employee, the active group coverage is always going to be primary, and then Medicare would be a secondary policy. And typically, Medicare is not going to pick up a whole lot afterwards, so that's why I wouldn't recommend having really the buying the Part B if you're going to stay on this plan. And we'll talk about that though in just a minute. But that is an option. If you don't take it now, you want to stay on the Market America plan. Whenever you retire or leave Market America, you would be a special enrollment period and an opportunity to enroll in Medicare at that time. And then you've obviously got the annual enrollment period every year between October 15th and December 7th. So if for some reason you just chose not to take it when you turn 65 and you don't have a group plan, you can enroll in it every year and make some changes between October 15th and December 7th in that enrollment period. Okay? So there are two ways, as I mentioned, to receive Medicare. And I really want you to think about these in silos because they're totally different. You've got the traditional Medicare, which is your Part A and Part B. And then your Part D is that optional add-on to help you with the cost of prescription drug coverages. So there's really four aspects. Your Part A, your Part B. You buy a prescription plan if you want to, and typically people will want to, because if you don't, you're paying the full cost without any discounts, typically of your prescription drug coverage. And the fourth piece is a Medicare supplement, because typically Part A and Part B are only going to cover about 80% of costs, right? So you're going to want to have something to help supplement that 20% that you're going to have to pay. I'm not familiar personally with anybody that has taken traditional Medicare and doesn't have a supplement to help offset the additional cost that Medicare doesn't cover. So that's the traditional way to get Medicare. Then you've got the Medicare Advantage, Part C. Provides the same aspects of Part A and Part B, but it really looks and feels like your plan you have today. It's got co-pays, it's got a deductible, it's got an out-of-pocket maximum. The Part D is typically included within the Medicare Advantage plan, but typically the Medicare Advantage is going to be cheaper because you've got more out-of-pocket exposure with a Medicare Advantage plan than you do with this. With a plan, if you do a traditional Medicare and buy the appropriate supplement, you can really have no out-of-pocket cost, with the exception of some prescription drug costs that can't be avoided based on the way the government sort of created the plan. But this one's going to be a little bit more expensive, but you have less out-of-pocket. This one's going to be cheaper, but you're going to have more out-of-pocket exposure potentially. And when you talk to people that sell Medicare, typically it's a 50-50 split down the line. Some people, 50% of the people will buy traditional Medicare with a supplement, the other 50 will buy Medicare Advantage. It's just really a decision you need to make about, it's more of a risk-reward decision. Like, are you more concerned about how much you have to pay every month and you don't want to be surprised by out-of-pocket costs, or do you want to keep that monthly expenditure as low as possible? And if you wind up having a few $1,000s out of pocket here and there, that's okay. You can cover that from a cash flow perspective. So the cost to you, and again, this is what everybody really wants to know, is what's this really going to cost me if I have to get Medicare? So Part A is nothing. It doesn't cost you anything. Part B, most people pay the minimum monthly premium of $104.90. Okay, that's if your adjusted gross income, and they look 2 years back, is less than $85,000. Okay, if your adjusted gross income winds up being more than $85,000, there's a sliding scale, and you could go on Medicare.com and find that if you'd like to, but you can actually wind up paying as much as, I believe, $340-some a month for Part B if you're making more than $250,000-ish a year, or $450 as a combined family if you're filing a joint tax return. Most people, I think 96-97% of the people wind up paying just the $104.90 because the adjusted gross income is less than $85,000. But one thing to keep in mind is that they're looking at your adjusted gross income from 2 years prior, right? So even once you retire and take Medicare, last year's adjusted gross income is going to be looking, you probably made a full year's salary unless you had somehow reduced hours. So that's something to consider as you're thinking about what the cost is going to be. But again, most people are paying that $104.90. The rate set by the federal government, it can change every year. The $104.90 though is the same this year as it was last year. So they didn't change that $104.90 this year. So Medicare supplement cost. The most popular Medicare supplement and the one that 80% of the people buy is a Plan F. And I'll show you a little comparison of the supplements in just a few minutes. But the most popular one is Plan F because it basically fills in all the holes in Part A and Part B. Everything that Part A and Part B doesn't cover, it basically covers, which is why I said if you bought the appropriate supplement and got your A and B, you could really have no out-of-pocket cost for medical expenses. The costs for the Medicare supplements are age-banded on many plans. It's called an attained age rate. So typically, plans will have one cost when you're 65, when everybody initially buys one, and then it'll either be maybe 66 to 69, 70 to 75, whatever, but the cost can vary based on your age and based on the insurance company. You know, United Healthcare's got their supplements, Blue Cross Blue Shield's got their supplements. There's some other kind of less known companies out there that provide Medicare supplements, so they can certainly vary.
So do they go up as you get older?
Yeah, they get more because they anticipate you having more claims as you get older, so they're trying to offset there. That it's not a huge, from what I've seen, it's not a huge variance, but they do go up every year. Rates are set by the insurance company and they do vary, but if you're planning and budgeting for a Plan F, you're typically looking at somewhere between $130 and $140. And the rates don't vary that much by the different plans. You know, they got A, B, C, D, E, F, G, it goes all the way to O. They don't vary enough between plans not to get a Plan F, in my opinion. You know, you may save $5 or $10, but you may wind up with an extra $1,000 out of pocket if you get admitted to the hospital. So in my opinion, and folks I talk to, Plan F's a no-brainer. I mean, that's pretty much what everybody gets. So, we're still talking about here traditional Medicare. So our Part A and our Part B, we bought a supplement to fill the gaps in Part B. Now let's talk about the cost for Part D. Wide range of plans and costs for Part D. And again, this is helping you with your prescription drug costs. It's not required that you buy a Part D, but you're going to probably want to, especially if you're taking prescription drugs. These can range from $20 to $150. So if you don't take a whole lot of prescription drugs, you can sort of get to the bottom of the barrel plan and you probably pay $20 for it. If you take some pretty expensive brand name drugs, you're probably going to wind up getting one of the ones that are $50 to $100 to $150, depending on which drug that is. Because the cost is really determined by what prescriptions you take. So it's a little bit different. I think there's 85 different varieties in North Carolina of Part D plans. So basically the way it works, now they have made this easy for you. You can go to Medicare.gov, and I would recommend you don't do it. I would recommend you talk to somebody that does Medicare supplements and let them do this for you. Just give them your drug list. But you can go in there, put in your drugs, and it'll pop in which ones will have, basically cover the drugs that you're taking, so that you know that you're not going to have any surprises when you. And again, if just taking a couple of generic drugs, you probably have your pick, and you can get one of the cheaper ones. If you're taking Enbrel or Humira or one of these really expensive specialty drugs, you may have to buy one of the more expensive Part D plans. Now, this is the most confusing part, I think, in Medicare relative to how this is where the whole donut hole comes in Medicare Part D. How exactly does the coverage work? What do I have to pay? What do I not have to pay? There's basically, Medicare has drawn the box of what the phases in Part B have to be. There has to be a deductible, then there's the initial phase, there's the coverage gap or donut hole, as you probably heard it, and the catastrophic phase. Now, what can vary based on those 85 plans is what your portion of the cost is going to be and how much the insurance company is going to pick up. For example, there has to be a deductible phase, but if you buy a more expensive drug plan, that deductible could be zero. It has to be there, but it could be zero. If you buy one of the cheaper plans, it may be $325. That's the maximum that it can be. Okay? So after you reach that deductible, which again could be zero, you move into this initial phase, where typically you're going to pay on average about 25% of the cost of the drug. And again, it depends on how they structure maybe co-pays in your Part D plan and things like that. But on average, it'll be 25% of the drug. Until you and the insurance company combined have spent $2,960 in prescription drugs. Now, if you're just taking a couple of blood pressure and a cholesterol and it's generic and they cost $12 a month, you're never going to get out of the initial phase, and it's not going to cost you very much. If you're taking Enbrel, anybody know how much Enbrel costs a month? Somewhere between $2,000 and $3,000 a month. So you get through that initial phase by February. It's for arthritis, for rheumatoid arthritis and inflammation and things like that. A lot of people are taking it now. But that'll get you right through there in 1 month, and you're automatically then into the coverage gap, or the donut hole. Okay. Now the donut hole's getting better than it used to be. They are paying a portion of drugs in the donut hole. You're typically going to pay something like 65% of the cost of generics, but generics are less expensive, so that actually winds up being a lower cost for you. I think you wind up paying something like 45% of brands, which is going to be a little bit more of a cost because the drugs are more expensive. And then once you're out of pocket has reached $4,700, you're at. Now I hope none of you ever have to go to the coverage gap. But again, if you're on Enroll, you're there by April. You know, if you're talking about a calendar year, right? I mean, you've kind of blown through all that, and then you're here into the catastrophic phase. The catastrophic phase is very low out of pocket. It's typically 5% of the cost of the drug, and I think a maximum of $4 and something on generic, $6 and something on brand. So they figure you've suffered enough once you get to the catastrophic phase, and they're gonna cover the cost of just about all your drugs. But does that make sense? Sort of understand how to progress through the phase. People are really confused about this. And this is where you're at. Again, if you do traditional Medicare or Medicare Advantage, either one, you're going to have this out-of-pocket cost, potentially. So it's important to know that, if you do the Part A and Part B, you buy a supplement, your medical's taken care of, but you do have a little potential exposure on the drugs, depending on what kind of plan you buy. Any questions on that? Okay. So this is an example, again, of sort of what original Medicare would look like if you sort of combine all those plans together and what your potential cost could be. So again, you've got your Part A hospital insurance. It doesn't cost you anything. And again, I should have mentioned before, it doesn't cost you anything if you have the adequate number of work credits, which I'm sure all of you do. I think it's something like 20 quarters or something like that of appropriate work credits. I'm sure all of you have what you need there. Part B, as we said, will typically be $104.90. Unless you have a pretty high adjusted gross income, and if you have that high of an adjusted gross income, you can probably afford to pay more for your Medicare. But it'll typically be $104.90. Your Medicare supplement, again, it varies based on which one you buy, but it'll typically be somewhere between $130 and $140 a month. And then your prescription drug plan, which, as we said, can vary from $20 to $100. So if you think about what your sort of budget would be if you were going to go to a Medicare, traditional Medicare with a supplement in Part D, probably somewhere between $275, $300 a month, okay? But remember, you've got no out-of-pocket costs that you've got to worry about as you go to the doctor, as you go to the hospital and things like that. You've just got to think about what your prescription cost maybe could be if you're taking a whole lot of expensive drugs, right? So that would be traditional Medicare. And this is what I just mentioned, and we won't spend a lot of time on this, but this is why we recommend Supplement F, because as you can see here, all these kind of boxes, things that Medicare, or gaps for Medicare that they don't cover, Plan F has an X in every box, because it fills in all the holes. The A, B, and C are really for those people that are under 65 that don't have a disability. And they go all the way out to O, but Plan F, again, 80% of the people take it, because there's just not enough of a difference in cost really not to, and it fills all those gaps. So that was traditional Medicare with a supplement and buying Part B. Okay, so that's an option for you. And that's really for the people that like to be able to budget. They know what they're going to spend every month. They maybe not like writing that check every month, or getting it, part of it will get deducted out of your Social Security check if you're taking Social Security for the Part B part. But you're not surprised when you go to the doctor. You're not surprised when you go to the hospital. Some people enjoy that. The other option, again, is Medicare Advantage. And you can either get a Medicare Advantage HMO or you can get a Medicare Advantage PPO. Is everybody familiar with the difference between an HMO and a PPO? So an HMO is network coverage only, right? You can't go out, if you were in, you probably, depending on which, if you went with Blue Cross or United Healthcare here in North Carolina for a Medicare Advantage plan, you probably won't have much trouble finding an in-network doctor. The challenge is if you get something serious and they say, oh, you need to go to the Mayo Clinic, or you need to go to the Cleveland Clinic. In those cases, maybe your doctor's not in network and you're stuck, in that particular instance, because you're not going to have any benefits if you go out of network. So I typically don't recommend, these are very inexpensive, but I typically don't recommend them just because I hate for people to wind up getting stuck in the middle of the year, even if your initial doctors were in network, if something pops up and not having access to the doctors you need to go to. But again, you're going to be able to get one of these for less than $150 a year. And this is including, so you're paying your Part B. You still have to pay your Part B when you do Medicare Advantage. But the cost of this Medicare Advantage plan is probably less than $40 a month if you go HMO. Okay? So as opposed to the $300 a month, you're looking at $150, so half the cost. Now if you do a PPO plan, it's going to go up more to like the $40 to $60 range, because you're paying to have access to all providers and have those out-of-network benefits, as opposed to the HMO style where you can only go in-network. So in that case, you're looking at $165. And again, this sort of shows you the structure of an Advantage plan. Again, and I would just say it feels a lot like your plan that you have today. You know, again, the HMO plan is probably less than $40. There used to be a whole lot of $0 HMO plans. You know, that's when you get all the things in the mail that say, hey, you can get your Medicare Advantage for free. Medicare's changed their reimbursement rates a little bit, so a lot of those $0 plans have gone away. Because, just so you understand how it works, what happens if you take a Medicare Advantage plan, you're basically assigning your Medicare benefits to an insurance company. And so what Medicare does is they write a check for $700 for you and send it to that insurance company. And so if your claims are less than $700 for that month, they win. If they're more than $700 a month, they lose. You know, and that's sort of what they're doing with these Medicare Advantage plans, is hoping that overall the money they get from the government and what little premium you pay them is going to be less than the claims they pay. And if it is, they win. That's why a lot of Medicare Advantage plans come and go, because sometimes they work for insurance companies, sometimes they don't. And they're very quick to sort of end those plans and get rid of them. My grandmother was on 2 Medicare Advantage plans, and you know, she was on one 2 years ago and it got terminated. She was on one the next year, it got terminated. And so finally we went to traditional Medicare, because she was tired of having to hop every year and find a new plan because it was going away. But again, on the HMO, obviously the big difference there is you've got the in-network benefits only, you've got a choice on the PPO plan. You have co-pays when you go to the doctor's office, just like you do now, and they'll vary for specialists in primary care. And again, the more expensive Medicare Advantage plan you buy, the lower your co-pays will be. And that's true for all these benefits. Inpatient hospital, you're going to have some sort of a deductible, probably maybe per day when you go in, depending on which type of Medicare Advantage plan that you pay, with a max. They do include the Part D coverage in those Medicare Advantage plans, so you don't have to buy a separate Part D plan if you do the Medicare Advantage. That's all bundled together in the Medicare Advantage plan. Got a copay for urgent care, a copay for outpatient surgery, X-rays and MRIs and things like that. It pays a percentage of. The total out-of-pocket maximum will vary. It's actually gone up quite a bit in the last couple of years. I think this year the maximum out-of-pocket is between $6,000 and $7,000 on one of these Medicare Advantage plans. So that's why I say you're paying less premium, but you're risking that potentially you're going to have a fairly large out-of-pocket if you have to go to the doctor. Your routine physical exam is always included. Emergency room visits, you have a copay, and for ambulance services, you have a copay. So let's stop there. We got about 6 minutes. What I was going to do, so if you turn 65 here at Market America, you've got 3 options. Okay, you can do that traditional Medicare with the Part A, Part B, buy a supplement, and buy your Part D. That's an option. You've got the Medicare Advantage option, which sort of bundles it all together for you, and then you've got the option of staying on your Market America plan once you turn 65. So what I was going to spend a couple minutes doing on the end is just reminding you sort of how your Market America plan works, and then what the cost of that was. But before I do that, any questions about Medicare that we didn't cover, that we didn't answer, that we can help you with? Do you feel like you have a little bit better grasp on Medicare than you did before you came in? Okay, well that's a good thing. So remember on your current Market America plan options, you got your 2 plan options. You sort of got your premium plan and your value plan. Okay, your premium plan's got lower out-of-pockets, lower deductibles, things of that nature. Your value plan is a little bit higher. So from the deductible perspective, the premium plan is $500 for an individual, $1,000 for the family. The value is $1,200 for an individual, $2,400 for a family. Then the out-of-pocket on the premium is $4,000 individual, $8,000 family. Value is $5,000 individual, $10,000 family. And then this plan, the value plan is an 80-20 plan, whereas the premium plan is a 90-10 plan. There's also a difference in the copays. This just talks about how things are covered at 80% on the value plan, 90% on the premium plan. But for example, the urgent care copay, it's a $50 copay on the value plan, $30 copay on the premium plan. Office visit copays, primary care is $30 for primary care and $60 for a specialist on the value plan. on the premium plan, $25 for primary care and $45 for a specialist. And then preventative care is covered the same on any of the plans. It's always covered at 100%. And again, you sort of know what you're paying here. Obviously the value plan has lower rates. The premium option has higher rates, but you can sort of see what those are there. If you're doing employee only on the premium plan and you've got wellness, you're probably looking at paying something like $850 a month or year in premium. And so you think about, you've got a $4,000 out of pocket there. So it's a potential, if you had a bad year and met your out of pocket, you could potentially, with what you paid in premium, plus your $4,000 out of pocket, you could be out of pocket about $4,800, right? That's sort of your maximum exposure between premium and the out of pocket cost. Now, if you don't have a lot of claims, you don't have to worry about that $4,000 out of pocket. You just got to worry about what you're paying in premiums every month. And then, so the Medicare Advantage, remember that the value in that is the fact that there's lower cost, but in that one you could have up to a $6,600 out of pocket. So you're paying like $140, $160 a month, plus up to maybe $6,000 out of pocket. And again, for those people that are conservative and really like to build a budget, you can do that, around somewhere between $3,000, $3,600 a month for that traditional Medicare, the Part A, the Part B, the supplement, and the plan, and the Part D. And you really don't have that additional out-of-pocket risk, except for your prescriptions, if you're taking a lot of prescriptions. So again, if I'm putting these in these three silos, this is the most conservative approach, because it's the most expensive monthly approach, but you know what you're going to pay every month, and you know you're not really going to risk much out of pocket. You're probably not going to be out any more than $4,000 a year if you went with the traditional Medicare option, as long as you're not taking really extravagant prescription drugs. Then you got that Medicare Advantage option, which again keeps your costs low every month, $140 to $160, but you could have some substantial out of pocket if you have to go to the hospital and things like that. And then you've got your Market America plan, which is your lowest cost every month. Again, we're talking about employee only on the employee only, that's non-wellness. So if you're in wellness, you've got employee only $1,735 a paycheck, which is $70, between $70 and $80 a month. That's inexpensive. And you've got up to $4,000 out of pocket though on that sort of premium plan there. So this one's sort of in the middle of the potential risk reward. But does that make sense? You sort of understand what your three options are and sort of what the potential cost and risk could be associated with each one? What kind of questions do you have?
So if your out of pocket is like $4,000, and then it said that surgery or anything like that, it pays 90%.
Mm-hmm.
So that other 10%, as long as you pay $4,000, you don't have to pay it.
Yeah, you're exactly right. So on this one, so if you were to have a surgery, and let's say that you were on the premium plan, you pay the first $500, just like a car insurance deductible, right? You pay the first $500 before the insurance starts paying anything. Once you've paid your $500, the plan starts paying 90%. You're paying 10%. Okay. So again, if you've got, let's just say you've got a $20,000 bill for an inpatient stay, the plan's paying $18,000 of that. You're only paying $2,000. So it would take a long time for you to reach that $4,000 out of pocket. But let's say you did. Let's say the bill wasn't $20,000, it was $200,000. Once your 10% gets to that $4,000, the plan starts paying at that point 100%, and you're not paying it. And that's the way the out-of-pocket works on the Medicare Advantage too. There's co-insurance percentages and things like that, but once you hit whatever that out-of-pocket max is, at that point the plan, or Medicare in that case, would start paying 100%. You wouldn't have to pay out of your pocket anymore. And that's the way that works. That's a very good question. Any other questions? So for you all locally, I would encourage you to write this number down. His name's Lynn Boney, works for Kraft Insurance here locally. Good guy. He's the person that I've sort of trusted to do all my family members' Medicare, and I recommend him without any hesitation. He's the best in town for sure, and he'll do a good job. So if you're curious about Medicare with supplement or Medicare Advantage plans, if you're getting close to that 65 point and you want to find out what might be best for you, give him a call and set up an appointment. And again, if you want to, he'll be happy to run that Part D thing for you, to what drugs you've got, what plan would be best for you. But he does a very, very good job. And again, those of you that are watching remotely, feel free to email Ed Kester, and we can try to find somebody to help you out with a Medicare supplement or a Part D plan in your state as well. Any other questions? All right. Thank you all very much for your time.
Thank you.